Thank you, MC. Director, Fountain Care Director, our District Hospital Nurse Manager, all the facility in charges and officers who are here. I'm particularly delighted and happy to be part of this mid-year review. And like I did indicated at the beginning, such meetings are meant to share ideas and then identify our weaknesses and subsequently chart the way forward. As we conclude our half-year performance review, I actually want to extend my heartfelt appreciation to each and every one of you for the hard work and dedication, and then the unwavering support that you give to the duties that you have been assigned to, all geared towards improving the health and well-being of these people living in this district. The meeting actually is an opportunity for us to reflect on our achievement, identify areas for improvement, and set the clear, achievable objectives or goals for the rest of the year. So do not think that if you didn't achieve certain targets at this point in time, well, comparing it with the previous records, you will say that you have failed, but going forward, you could make changes. The data that we all shared here is an insight that we all have, which are very valuable, and as we continue to strive for excellence in our services, we need to actually be focused. I'm very encouraged by the progress we have made so far in areas like some of them include we have zero mortality and infant mortality for the period in question. ANC coverages are also encouraging. In fact, on the average, every facility or sub-district have actually achieved their targets from what I have seen here. For that matter, I am confident that with the continuous collaboration and effort, we can overcome the challenges that we are all facing here. And I'm particularly happy that Dr. Duodo of Fountain Care Hospital has talked about collaboration. It is the way to go. If we do not collaborate, we are far from achieving our goals, because you alone, me alone, we cannot achieve our goals. Dr. Duodo is not collaborating with only Ghana Health Service. He is doing the same with Ministry of Health. As I said, Ministry of Health here, with the training institution that we have here, we are closely in touch, and that shows how the importance that he attaches to collaboration. The challenges that we are all referring to here, that the district is facing, is all over. Sometimes people think that when you leave Sampa to other places, there will not be challenges. You get there and see. You'll be surprised that certain issues you thought they don't exist elsewhere, they will be there. The only thing that you wouldn't find probably is bad rules, because everybody mentions transport, whatever, as their challenges, but nobody mentions bad rules. The rules are terrible, very, very terrible. You have a vehicle in less than 6 months is broken down. So that is the issue. And I also want to comment on this. Those of us at the sub-districts, there are certain cases that we do not need to attend to. All we need to do is to educate them on your strength or what the law permits you to do for them. Up to that level, then you can refer. As Director mentioned, that referral is part of our treatment or management. So, several patients or clients have suffered because some of us attempt, like trying to impress the patient or the relatives, and then also making them to see that, yes, we are doctors, we are health. No, we have limits. So that issue, a lot of patients and relatives have suffered. And for instance, with the eye care that the officer was talking about, a little mistake, the person has gone blind. So if you meet such cases, you do not need to toy with them because they are very, very serious issues that the good that you intend doing to the patient, you end up worsening this or the case. So those of my friends at the sub-district level, chief compounds, let us be careful about the cases that we handle. In recent times, we have a lot of lawyers working with their certificates, looking for a job. And some people can take us to court if you handle cases that you are not supposed to do. Meanwhile, if you don't intend doing anything bad, you wanted to help. So let's use the referral system when we have cases that we cannot handle. Then with the transfers and other steady leaves, nobody wants to come to German law. It's a reality. I have had a number of staff that were posted from ministry, and they all declined. We could not add midwifery to our program because we do not have the faculty to do that. You get a midwife, they will post the midwife today. You go on Google to see where German law is, what is the next time you don't hear. You call, the phone is off. When you call ministry, they will tell you that just forget of that midwife, don't forget of that staff, and see how you can manage. They have all declined to come. So those challenges, if you find yourself here and the district director is not allowing you to go, try to find Canaan for yourself here. Because he, as the district director, will not allow you to go so that he will fail. No. And human beings are here, so we have to make our corner bright and to discharge our services. The people here, it's not their fault, and they also need health care. So let's try to see how we can actually make things comfortable for ourselves. The only challenge that I do not support them is they use cashew buyers to make sure that we pay rent as the other people. Me and you, how much is our ticket? You want a single room and it's going for 300, 400 because there is washroom inside. But let's hear with them and see what we can do. Other challenges that I want to direct. I think the issues that Dr. Duodo raised are very serious. While you are doing your bed net distribution, you should also have to add that education. It is painful that they use the taxpayers' money to use it to fence a place as a farm. It is very serious. So, and that is how come some of the things that we do, if the figures that we are seeing here, they are all genuine, I think with time we will not have challenges. The public health sector is very important. If they are preventing the conditions, that report at the hospital. Fountain Care, Dr. Duodo and his team, the Sampa Government Hospital, they will not have much to do and will not waste a lot of this thing. So let's try to add the education. I know you've been doing it, but that has to be intensified. I know that those who distribute these bed have probably seen this observation that Dr. Has seen. But they didn't give it an attention. They thought it was just some wretched bed that they use. So let's do that. I think for the sanctions, all of us here cannot impose sanctions on them. They know what they are doing. So, having looked at the few issues and the challenges that you have, the sub-districts and all facilities, wherever you haven't actually done well, do not worry. It's just a half year. 10 months you've done 5, so the rest you can increase your speed to achieve your targets. It's very important and it's a national issue that they will be happy with the district. So going forward, let us keep focus on our strategic objectives, especially in areas we have identified the gaps. I urge every team member to take the insights and actions plans discussed today to heart and work diligently towards achieving our shared objectives as well as the SDGs for health. Let us be reminded that our collective effort is the driving force behind our success. So let's keep together, support each other. And you bear with me that Director has indicated, and Dr. Duodo also mentioned that, how they were able to send staff to go and manage a case outside their facility. Any selfish private person wouldn't do that, because that would be giving credit to that facility. So let's join hands, collaborate, and see how we can give better care and services to the people of this district, irrespective of the harsh conditions we are facing. On that note, I also want to request that the district or the health directorate and the assembly contact them. I have a lot of very good students who are equally poor. Some drop out from school because they cannot pay the fees. And sorry, I'm projecting Dr. Duodo so much, but he has taken interest in sponsoring some of these people free of charge. He doesn't even. He is not giving them any conditions that after you complete, you have to come and work with me. Again, in knowing the challenges we have with staff, he has also supported our project, classroom project, with some amount of cash. I can't mention that anyway, but it's handsome. That the issues in town are not good, but I think going forward, when the dust settles, Dr. Duodo will have to be honored for the numerous health services that is given to the people here. I do not think his facility is a private one. I think the best we can say is a faith-based facility. And like I said, we all need to join hands to do that. Listen, we are not new to you. But we urge you to go a step further to see how you can help us solve some of these problems. With regard to the staff challenges, that is why we are trying to train more people. So all of you, when the students come to your facilities, they do not have the practical skills. Take time to train them. The training is not just helping them to give injections. That is what a lot of us concentrate on. Don't do that. Help them and train them practically and holistically. Not yes. So that when they are, because they are trained here, at the end of it all, they will accept posting to this place so that you can go to the city that you want to go. So that is a task for you. That's the only way we can do so that we can leave this place. Director was at Duodo. I was in Duodo, but eventually I found myself in this corner of the country, which is this. But we are delivering our quota to the nation. So you are even lucky that Director is giving a year of free accommodation to those who are coming. Everyone again for your hard work and dedication, and let us continue to work together with passion and purpose to make German North District a model of healthcare and well-being. Thank you for your hard work.